So today I'm going to be talking about how to proceed with a blood transfusion. First off, I would introduce myself to the patient, wash my hands. I would then verify the orders and specific blood or blood type products, the date, the time, and such, and any post-transfusions meds like Benadryl if they had a previous reaction. I would obtain the patient's transfusion history as well as any allergic reactions. I would send in cross-match and typing within 72 hours, and this is when the patient should receive a bracelet. I would verify that the IV site is patent and doesn't have any complications. I would assess the labs for such as H&H, PT, T, INR, platelet counts, and I would also check to make sure that the patient has signed the consent form. And I would need to know the indication of the transfusion, which would be, in this case, the patient has low hematocrit due to liver hepatitis. Record vitals, blood pressure, pulse, respirations. I would not give a blood transfusion for a fever over 100. And then I would assess the patient's understanding of the procedure to provide any anxiety relief. Identification is done. I would talk to the patient about signs and symptoms as well as any reactions to tell us immediately so we can stop it. So after my assessment, I would go down to the blood bank and I would obtain the blood sample. I would compare and contrast with the lab tech there, the date, the type of blood, the number, and everything. And I would also check the blood product itself to make sure there are no sediment or bubbles or anything wrong with it. So when I come back into the room, I would have a second RN or LPN with me, and we would be matching identifications between the bracelet, the blood, the type and cross match, and the physician orders. So for administration purposes, I would have done my hand hygiene and put my gloves on. I would check the tubing and make sure all the clamps are closed, which they are. And I am going to start out with the normal saline. I'm going to hang this, open this line to prime this line with the normal saline. And I get it over the filter so as not to cause the red blood cells to lyse. So I've primed my line, and now I'm going to do the blood. Now that that's up, I'm going to make sure that's locked. That's locked. And now I'm going to open the blood. The blood procedure is almost finished. If I was to have a second unit of blood, I would be going back down to the lab and grabbing that. However, if it was only one unit, I would be flushing with just normal saline to finish the product. Then I would wash my hands, and then I would document. I would also check with my patient to make sure they're feeling okay and that they were comfortable before I left.